Hi everyone. We've been talking about breast cancer for a while, and today is breast cancer 4, which will be mainly on complications. So, with breast cancer complications, we should end this series. Okay, let's go. What are the psychological complications? When a woman, a hardworking woman, a mother, good wife to the husband, or even single, anything that the woman chooses to be, everything is been good, life is fine, but suddenly she's diagnosed with breast cancer. What will happen? There'll be fear, there'll be anxiety. I don't know what the future holds. How long am I going to live? Or it has even metastasized, and the woman has been told you have 3 to 5 years to live. My goodness. Become depressed. Some could become suicidal. And some will go into full denial. So, no, that's not my portion. I reject it. Some will become more religious, focusing on the Supreme Being to help. Some become angry. Some will feel lonely, particularly those who have been living by themselves, might be through divorce or far away from home, as the case might be. Some may decide to isolate themselves because they may not want to share their problem with someone else or become problem to another person, either their spouse or family members. Or the spouse or family members may decide not to be supportive and they're by themselves. It could be in any form, so psychologically affected. There could be weakness in their spirit and in physical. It can be sad and be in shock, particularly if they've never known about this in their family lineage. And some may choose to be blaming the ancestors for the genetic part if it comes out to be it is as a result of inheritance. It could be a kind of financial burden, particularly in many parts of the world where the healthcare delivery is not covered by the government. Could be stress on the supportive spouses and the good family members who will stand by. After surgery, and like I've said in previous presentations, surgery will be chosen if it has not reached stage 4. And stage 4 involves distant metastasis. So, when there is the possibility of surgical intervention followed by radiotherapy and chemotherapy, preceded by neoadjuvant chemotherapy, then there is possibility of wound infection. Wound infection on account of which the woman will be placed on antibiotics, and there's possibility of serum accumulation underneath the skin and necrotic tissue after. Some will even experience what we call phantom breast pain and anesthesia with the possible problems associated with it pre, during, and after would have been fully discussed with the patient by the anesthesiologist. There's possibility of nerve injuries, particularly if there is axillary lymph node dissection, brachial plexus injury along that region, and lymphedema when the lymph nodes are removed, no more drainage, and there will be separate presentation by me on lymphedema later on. Well, anywhere you have a cut, you're bound to have a pain. So, it's likely going to be painful during or after. Chemotherapy. You are all familiar with the word chemo. Many people would have taken chemo around you. These side effects that I'm going to state now is not limited to the fact that chemo is used in breast carcinoma. No. Anytime you use chemotherapy, the individual that's using the medication is likely going to come down with any or many of these. Okay? Now, let's talk about chemo fog. Before chemotherapy, somebody around you or yourself, you don't forget anything, you're fine, but when you are on chemo, you find out you have a kind of chemo fog, you forget things, and so on. It's possible there's arrhythmia where the heart electrical system will be malfunctioning. I will not be able to go into details of that right now because I have made presentation on atrial fibrillation before. You can check it out and have a look. Myocarditis, inflammation of the muscles of the heart itself, and even the covering called pericardium leading to pericarditis. Cardiomyopathy, when the heart is massively involved, leading to congestive cardiac failure, and there's possibility of dehydration and fatigue. Neuropathy and ototoxicity in many. Menopause, yeah, I'm going to dwell more on this because when somebody is young, is on chemotherapy for breast carcinoma, and suddenly she's declared to be in menopause because the menses are ceased for complete 1 year now. And the question will be, why me? I'm still young. Yeah, you're young, but unfortunately, the chemotherapy has killed all the growing cells, including those ones in the ovary. So no new follicle or graven follicles, no maturing into adults and luteinizing to release eggs anymore. Then you are done. You are in menopause. Pulmonary embolism, when there's deep vein thrombosis and it ascends up to block the pulmonary artery, the individual is coming down with dyspnea, cough, sweating, heart rates, is breathing fast, and the rest. Immunosuppression because the new growing blood precursor cells, white blood cells, red blood cells, now just growing in the bone marrow are kept from growing because that is how chemotherapy will work, killing all cells that are growing. And that will lead to decrease in immunity, both cellular and humoral. Menopausal symptoms from exactly what happened at menopause, like I explained earlier. Mantle cells, dyspnea from possible pulmonary embolism or congestive cardiac failure. There's possibility of cough from either congestive cardiac failure or pulmonary embolism, or just pulmonary edema. There's possibility of infection from immune suppression, anemia because the red blood cell forming cells, erythroblasts in the bone marrow are destroyed. Nausea and vomiting because the lining of gastrointestinal tract is destroyed right now, so absorption is decreased, and bleeding because of thrombocytopenia. There'll be air loss because the new cells that's going to grow to full air is already destroyed. And hemorrhagic cystitis, the bladder is involved in the excretion of the metabolites. Infertility because no gametogenesis. The new cells that are supposed to form the sperm or the eggs are all destroyed. And that is why before some people will embark on chemotherapy or radiotherapy that will affect that, they could affect their spermatozoon, the males, through phase difference and keep if they still need to produce offspring later. They are there for the same purpose and, of course, constipation, because chemotherapy will indiscriminately prevent growth of new cells. Unfortunately, it's not going to limit that to the cancer cells. It's going to affect all new growth cells, including this gametogenesis that's going to be occurring periodically in both men and women, and that will also be affected. So it's a serious matter when any woman or man of childbearing age will be undergoing chemotherapy. We put that into consideration and probably take the time to help them out before they will commence chemotherapy. Radiotherapy. The possible side effects are not too far away from what we get in case of chemotherapy. There's possibility of pulmonary fibrosis, chest pain, itching, burning, blistering, peeling, and hair loss. All those ones may occur on the skin, and leukopenia because it's going to affect the white blood cells formation and the lungs in particular. And to medical students and nursing students, pulmonary fibrosis should not be forgotten when it comes to side effects of radiotherapy. Pulmonary fibrosis. As possibility of sore throat and swallowing difficulty, forgetfulness, because it's going to be cognitive impairment. The individual become weak and fatigued and be sleeping a lot sometimes. Seizure disorder, hypothyroidism, because when it is directed at the chest region, close to the neck region, it could kill the thyroid gland. In fact, there's possibility of hypopituitarism affecting an array of hormones, not just one, but when it's affecting the thyroid gland along the neck region and parathyroid gland, there's possibility of hypothyroidism and hypoparathyroidism. So it's possible to have headache, and in hormonal therapy, it's likely the woman is going to have nausea. This is going to happen in those taking tamoxifen because they have breast cancer that is estrogen receptor positive. So there's possibility of nausea, hot flashes, fatigue, headache, endometrial carcinoma, deep vein thrombosis, stroke, and myocardial infarction. They may have mood changes, the libido may be down, could have constipation, and the hairs could become thin, come down with dizziness, bleeding through the uterus, abnormal uterine bleeding, probably because of endometrial carcinoma right now. And when the bleeding is massive, it be having shortness of breath and dizziness, and they could have visual problems as well. In conclusion, I've reached the end of the road as far as breast CA is concerned. Send all the 4 videos to everyone, wishing all the affected women and men well as they undergo these horrible therapies. Thank you for listening to my 4 presentations on breast cancer. When you go over all of them from 1 to 4, if you still have any question, kindly leave a message on my channel and I'll try to address it. Again, as a kind of disclaimer, this is not meant to replace the interaction you are expected to have with oncologists, your general practitioner, or your nurses. Thank you.